If you're studying for the NCLEX, you already know that neurological questions can feel like a total maze, right? They're super complex, they're definitely high stakes, and they really test your clinical judgment when you're under pressure. But what if there was a simpler way to see through all that complexity?
See, this right here is the key. The NCLEX isn't trying to trick you with some obscure disease fact. What it's really asking is, can you spot a critical change in your patient, and do you know what to do about it? Like, right now. It's all about applying what you know, not just reciting facts from a textbook.
And let's be real, the stakes are incredibly high. In the real world, missing these signs can have devastating consequences. And on the exam, well, it can literally be the difference between passing and failing. The NCLEX has one job, to make sure you're a safe and competent nurse.
So, let me just say it again to be super clear. Your success isn't going to come from memorizing every single symptom of every single condition out there. Nope. It comes from knowing what to do first. It's all about having a system for how you think.
You know, the biggest struggle for most students is just plain information overload. I mean, you've spent years learning thousands of details. And now, suddenly, you're expected to sort through it all in a matter of seconds. And this is especially true with neurology, where so many symptoms for different conditions look unknowingly similar.
This slide pretty much nails the core challenge. On one side, you've got these acute emergencies. Think head injuries, seizures, strokes, where every single second counts, and your first thought is probably airway, airway, airway. But then, on the other side, you have chronic disorders, where the priorities totally shift to things like managing function, long-term safety, and medication. So how in the world do you prioritize for both?
Does any of this sound familiar? That feeling of trying to figure out if aspiration risk is more important than fall risk in this exact moment? Or maybe missing that one subtle change in consciousness that turns out to be a massive red flag? Trust me, you are not alone. The NCLEX is actually designed to test you on these tricky spots.
But what if you could just clear away all that clutter? What if, instead of trying to memorize 6 completely different care plans, you had just one single framework to tackle pretty much any neurological question that comes your way?
And that's exactly where a framework comes in. It takes all that complexity and distills it down into a really clear, high-yield structure. It basically gives your brain a roadmap to follow, so instead of panicking, you can just analyze, prioritize, and act. All right, let's see how this actually works.
Okay, take a look at this one. A classic high-stakes NCLEX scenario. Your mind is probably racing with a dozen different things you could do. So out of all those options, what do you do first?
Before you even think about a specific task, the framework forces you to think in priorities. Is the airway clear? Are we watching for signs of increased intracranial pressure? Is the patient safe and stable? This structure immediately helps you weed out the wrong answers and points you straight to the correct one.
Okay, let's try another one. This is an acute emergency you'll definitely see on the exam. A child starts having a seizure right in front of you. There's a lot you need to do, but what is the absolute #1 must-do first priority?
And again, the framework just cuts right through the noise. Airway always comes first. That means positioning the child to prevent aspiration. Next up is safety, protecting them from injury. And then finally, you document. You see the pattern here? It's a simple, repeatable process.
Okay, but what about chronic conditions? They're a different beast, right? Let's look at this scenario. This isn't a sudden crisis like a bleed or a seizure. You have a patient with Parkinson's, and their symptoms are getting worse. So what's your priority now?
This shows you just how flexible the framework is. The focus shifts, but the underlying logic stays the same. First, you assess their functional status, especially swallowing, because guess what? That's a direct threat to the airway. Then, you look at the bigger safety picture, things like aspiration and falls. And finally, you start to consider if their medications might be playing a role.
So here's the bottom line. Every single example we just walked through follows this exact same principle. You recognize a change, you prioritize the biggest threat, and you intervene to keep your patient safe. That right there is the formula for NCLEX success.
And that's really the whole point. This isn't about cramming details about 6 different diseases into your head. It's about learning one system for clinical judgment that you can apply to dozens and dozens of scenarios, whether it's a neuro question, a cardiac question, or anything else they throw at you.
This is what we do. We're not just another content review company. We're a clinical judgment training platform. Our goal is to prepare you to think like the safe, effective, and confident nurse the NCLEX expects you to be.
So if you remember nothing else from this, please remember this. When you're staring at those 4 answer options, just ask yourself one simple question. Which of these actions keeps my patient the safest right now? That, my friend, is almost always your correct answer.
So what you just saw was just a quick glimpse of how our framework can completely transform your NCLEX prep. The full system with all the detailed breakdowns, practice questions, and rationales for all these conditions, well, it's all waiting for you right inside Genius Exam Coaches.